So Dave, today we're talking about sports injuries to the shoulder. I would imagine that these are easy to get. So what are some common shoulder injuries that result from doing sports? I'm not an athlete, so I don't know.
Well, like the most obvious are like strains and sprains, where you're contused or you're hit or you have your arm pulled back and you strain something. Those are the obvious ones, and they happen in a lot of sports.
Right.
But the most common shoulder injury from sports is just overuse.
Right.
The shoulder is a incredibly mobile joint. I mean, that's where we can put our hands just about anywhere we want to.
Right.
But that mobility also is because it's relatively unstable.
Oh, okay.
And so that instability then can lead to some overuse. There's one big group of muscles. There's 4 muscles that make up a complex called the rotator cuff. And the rotator cuff is that 4 muscles that keeps the shoulder stable. And so when you have a lot of activities, or you've thrown a lot, it's golf, baseball, swimming, overhead sports are really taxing on that rotator cuff. And so when they get to the point where they've just fatigued, then they start to break down a little bit. That breakdown then leads to more instability, and that instability then leads to tendonitis and bursitis and what we call shoulder impingement.
Right. Okay. So what are some ways that physical therapy can help with those types of injuries?
Well, with the overuse injuries, our biggest concern, number one, is reducing the inflammation. Because if we try to strengthen an inflamed muscle, it's just going to get worse.
Okay.
So we do a lot of anti-inflammatory modalities, and we work on posture a lot. Postural influence on the rotator cuff is very significant. When we slouch our shoulders like this, there's the ball of our humerus comes up here, the head of the humerus, and it kind of sticks into this little unstable joint called the scapula.
Okay.
And so when we do this, that humerus rides right up there and it kind of rubs up against where the rotator cuff is. So the first thing we do for these inflamed rotator cuffs is we work on posture.
Okay.
And I know we've talked to you about posture and with back pain and neck pain.
Right.
And the same thing with shoulders. So when we get the shoulder blades back like this, that humeral head slides back, there's more room underneath what we call the acromion.
Okay.
And that allows that tendon to heal. And then the second thing, once we calm down the irritation, is we try to work on building the rotator cuff. We'll do a lot of strengthening exercises and dynamic stability. Again, it's an unstable joint, and we're trying to make it stable by strengthening.
So when you say that you can't work on that inflamed joint, do you have to wait until that injury has subsided to start the physical therapy?
Oh, no. In fact, the physical therapy helps to speed up the inflammation reduction.
Okay.
We have some local modalities that we can use, but also just the hands-on techniques. Believe it or not, soft tissue massage can actually help to bring in new fresh blood and new nutrients that helps to speed up the recovery so we can move on to the strengthening phase faster.
So when is it time to seek attention for those sports injuries?
Well, obviously, if it's a direct trauma, if it's a contusion, a sprain, or strain, you see your doctor right away.
Right.
For the overuse injuries, you don't have to rush to it every time your shoulder aches a little bit. But if your post-exercise soreness lasts more than 24 hours, definitely if it lasts in that 48-hour or longer mark, then it's time to go see the doctor.
Okay.
Especially if you find yourself, using a lot of pain relievers and using ice every day or after every workout for pain. There's probably something that we can do to help improve that stability, reduce your reliance on pain meds.
Fantastic. And what about those pain meds? I know it's funny, when you said reduce inflammation, my first thought was take some aspirin.
Take some aspirin, yeah.
Right. I mean, is that worth thinking about, or?
In the early stages, taking some non-steroidal anti-inflammatories, like ibuprofen or Aleve or those kind of drugs is useful in reducing the inflammation. But if that's the only way that you can get through your post-exercise day, then you have a bigger problem than just minor overuse or minor inflammation. And that's where you probably need to seek physical therapy help or talk to your doctor.
Okay, so when it comes to seeking physical therapy, how do we go about doing that? How do I get in to see you?
Well, for right now, you still need a doctor's prescription in the state of Indiana. We hope that's going to change by the middle of this year.
Okay.
So you would contact your doctor and say, can you write me a prescription to Indiana Physical Therapy? We have obviously 10 locations, so we're pretty convenient. And then just give us a call and we'll schedule it. But
you mentioned the 10 locations. You guys also have really convenient hours.
we do. Yeah, we're open 7 a.m. to 7 p.m. Monday through Thursday, 7 to 6 on Friday. So, you know, before work, before school, after work, after school, in the middle of your day, you know, we can find a time to work you into one of our locations. Our policy with our front desk is to try to get a patient scheduled within 24 hours of calling.
Fantastic.
Because we know how important it is to get started on the therapy right away. The sooner we get started, the faster the recovery.
Great. Well, for those of you who are athletes, you know that an overuse injury is a big deal. You want to get in here and get it taken care of as soon as possible. If you're not an athlete like me, but you're just a wimp and you want to get rid of that pain, be sure that you give your physician a call, get a prescription, and get into one of the 10 locations at Indiana Physical Therapy. They'll get you back on the move as soon as possible. Check them out on the web or give Indiana Physical Therapy a call today, and we will be right back on Insight.